Welcome to Iswam Visual 2021.
specific anti-aging course. Okay, for the audience, you will follow the presentation. And if you have a question, don't be hesitate to write the question in the Q&A box. And I will read your question immediately after the session finished and answer by Dr. Tompi directly. Okay, Dr. Tompi, you can start your presentation now, and the next 30 minutes is yours.
All right, good morning, everyone. I'm so glad to be a part of this great event that I believe already uh, so many years started before, right? Okay, my topic is how to use a botulinum toxin for facial aesthetic. How can we perform it safely? Due to confidential issue, please do not record and share any image of my patients because some of patient here is a high profile person. So and I don't have any letters of agreement about spreading their pictures for anything except my presentation. Okay, I'll start. The Botox, the botulinum toxins mechanism of action, as we know, yeah, it's very complicated process. But I think the most important thing that we need to know is this botulinum toxin is used for hyperkinetic lines in the face, neck, and chest. Also for facial sculpting and as an adjunct to other rejuvenation modalities. I believe all of us know about the structures of muscle under the skin of our face. It's very complicated, yeah, but it's really good to know how it works. So if you know this, all of these muscles, then we can regulate how they works to create a nice expression, a beautiful expression as we wish. Okay, I give you some example. If you see this muscle, uh, a depressor labii, yeah, uh, in aging or in some people, even though they're still young, it works uh, very powerful, creating the angle of mouth downwards. Yeah. So to balance, to push the angle upwards, we need to inject some part of some dose of botulinum toxin at this muscle. And then, so actually it works. It gives you a upwards lift because we make this muscle uh, weak. Yeah. So some people think that if you shoot botulinum toxin, then your face is become weird because it works very, the strength of expressions is become stiff. Actually, what happened is those toxin makes all of the muscles become weak. Once it weaks, it will give us the expression that we want. So it's really important to adjust the dose, to adjust which muscle that we will inject will be our target organs. All right, like this case, yeah, this is a hyperkinetic lines. You can see the the wrinkles of the frontal area. Yeah, once the patient, we can ask the patient to do the to lift up their brow, and then you will see the lines here. This is a hyperkinetic lines. Yeah, it getting worse in some people when they do the expressions. This kind of case is an indication for Botox, for a botulinum toxin. Also, you can see here, the eyebrow shape is not nice. The configuration is asymmetric, downwards. This kind of eyebrow will create a sad look. This also can be corrected using a botulinum toxin. And also, if you see the muscle here under at the lower part of eye, Some people have a very thick muscle over there. The orbicularis oculi at the lower part is become very thick, so create like a crying look appearance. That muscle can be reduce the thickness using the botulinum toxin also. So at this case, at this example, we already knows about how the botulinum toxin works. Not only to reduce the wrinkle lines, but also can balance or adjust the eyebrow level, and also make the some muscle become thinner. And then what about this case? In this case, we can see at the first pictures, this is the patient on with passive expressions. There is no deep lines or deep wrinkles, yeah. But we can see there's a very tiny, small lines at the frontal area. This is the condition on the passive expression. And when the patient express with lift up the eyebrow, and then we can see it becomes worse. So this is a hyperkinetic lines, and this is the lines that we can get on the passive condition, on the passive expressions. This is exactly the conventional botulinum toxin indication. But this one, is not easy to correct. Sometimes I have to do a combination with the fat transfer or a filler using a hyaluronic acid to fulfill the thin line, or we can perform also a new method, inject the Botox using a Mesobotox. So very intradermal Botox. This is another case that we can see the angle of her mouth is going downwards, and to adjust this, we need to inject some dose of botulinum toxin at the orbicularis oculi. Yeah, levator, depressor, the levator muscle, the depressor muscle. Sorry. And then this is another thing that we have to remember together. The structures of the skin. Yeah, I believe this is just a common pictures. Epidermis, dermis, subcutaneous fat, and the muscle. But the most important thing is at these structures we can get a lot of sweat glands, and then small artery, and then the some others smooth muscles. Yeah, all of those structures can be adjusted by using a microbotox or mesobotox. Microbotox itself is an injection of multiple micro droplets of diluted botulinum toxin A into dermis, or the interface between the dermis and the superficial layer of facial muscles. So what we can achieve from this treatment is to decrease sweat and sebaceous gland activity, yeah, and then to improve skin textures and to target the superficial layer of muscle that find attachment to the undersurface of the dermis, causing visible wrinkles. This is the one that we mentioned above. And then also, due to the effect of an oil glands, this treatment can potentially also to reduce acne, and also effect of these very small amounts of neurotoxin are subtle when used in combination with other procedures. Overall results are noticeable and potentially last longer. So it's really important to keep in our mind that you need to put the mesobotox and microbotox in every layer. So not only very superficial, sometimes you need to go a little bit deeper than a very superficial one. So it's depend on what your target. If you target it to reduce the oil glands production to reduce the acne, then you have to attack this. Yeah, to attack a little bit deeper, intradermal. And if you try to attack, if you want to reduce the redness appearance of the skin, also you can attack where the vascular, the small artery, capillary appears a lot there. And then this in the market. In the market in Indonesia, we can find any Botox brand, any botulinum toxin brand like a Botox. This I never see this part, but Xiaomin we can find it here. I think these two brands, Lansox and also Botulax is others brand that we can find in Jakarta. But in my experience using almost all of those brands, it's quite similar. Yeah, it's quite similar in the effect and dose, and also the all of them works like 4 to 6 months. So I don't see in my experience, I don't see any brands that much powerful than other brands. So for me, it's quite similar. The most important thing is you know how to use it. You know the composition and the dilution, the right dilution for any kind of botulinum toxin brand. Like if you use this board, honestly, I never used this board, but from the journal, from the literature that I read, that for this board you need the dose is like 3 times than others Botox or Xiaomin. So the onset of effect of this botulinum toxin typically is 3 times 24 hours. So it's really funny when after you shut the Botox and then the patient say, "Wow, doc, it looks nice. I love the result." Right away after injection, so it's a lie. It's impossible. That's not how the botulinum toxin works. It takes 3 days until you can see the result. Yeah. So maybe on the first 1, 2, 3, the first 1 or 2 days, or right after, what the patient see is the swelling effect, the minimum swelling effect, but happening almost all of face area. So give more puffy, nice appearance of the face. Yeah, sometimes looks okay in some patients, but it's not the result. So you should wait for 3 days. And then we should reassess the patient 2 weeks after, yeah, to see if there's some point that you need to adjust about the effect. So especially like, if you do like eyebrow for lip, even for others, or wrinkles sometimes at the frontalis or the glabellar area, we need to readjust sometimes. And then the typical interval for treatments mostly is 4 to 6 months. And in the new patient, almost all new patient is they can stand for 6 months. And what about complication? If we perform the wrong point of injections, or the migration happens, there's nothing you can do. Yeah, we just keep waiting. But maybe I can suggest what if it happens to me, I always suggest my patient to do the massage of their face, put a warm or ice compress, or sometimes we perform like a radio frequency treatment. But honestly, all of those is only to make our patients more comfortable. It's not really related with the complications. Yeah, just to make they feel like, okay, he treat me well, even though there's some complications. All right. And then always use the smallest volume of the lowest concentrations needed. Yeah, and then select the injection site so the treatment will not extend beyond the desired diffusion zone. And That's why it's really important to spend more times on the design. Always put your patients sit face to face in front of you, and then put a marker to design which point that you want to inject and why. Try to put it on our mind that our goal is to achieve a dynamic, beautiful result. So we don't I don't think it's nice or patient will be happy if the result is the wrinkle is gone but the face is become very weird look, like a alien, sometimes like an alien, because the eyebrow is too high, or the face is become too stiff, yeah, like no expression at all. So my tips, yeah, I always try to achieve a natural result. So sometimes I left some point not to be touched, left some wrinkles, yeah, unless my patient asks for no remove the wrinkles, then I'll put some more. But in my normal practice, I left some wrinkles, leave it there to create a normal appearance. But the changing is much it's contrast from the previous condition. And then, so based on those theory I mentioned above, I create a T-Rejuve. I call it as a T-Rejuve in my clinics. It's an advanced botulinum toxin cocktail. So I have I can't share here the concentration. I cannot share because it's my personal recipe. But what I can share is how to do it, how to inject, and the point. So this is what we can achieve with a T-Rejuve. You can see the skin textures appearance changing very well. Yeah, from the great big pore, now it's become very lean, very nice textures. This picture is no edit at all, as it is. I took the pictures like I took the pictures 2 weeks after the injection. And then this is another case. This is on the right side is the previous condition, and the left side is 2 weeks after. You see how the the tiny lines are gone. Of course, with the deep wrinkles also must be gone when she do some expressions. And then the eyebrow, so I put the injection here in all of frontalis area except the 1/3 part of the lateral eyebrow. So never do the injection at this area, never. If you do injection of botulinum toxin at the lateral part of eyebrow above, we can create a eyebrow ptosis, and you can fix it for 6 months. So please don't ever shoot at this area. And then for the wrinkles at the lateral part of eye, you can shoot like 3 points here, and like 2 units every point. And I always do deep and also superficial. So I have 2 layers. Yeah. And then also to lift up the angle of her mouth, lip angle. So I inject at the depressor labii 2 units to create a lift up angle. Sometimes it's depend on the patient. Sometimes I just use like 1 unit, sometimes 2 units, sometimes need more. Yeah. So it really depends on the patient condition. So that's why it's really important to evaluation we cannot perform Botox like a routinity, yeah, like a routine, always same dose in every patient, cannot, because every patient has a different character, different problems. This is also the botulinum toxin advance with my technique T-Rejuve. So I fix the texture of her skin, also the eyebrow symmetry, yeah, and then I lift up the corner of her eyebrow, and then fix all of the wrinkles at the frontalis area, the lamellar area, uh, and then also the pore. Yeah, her skin is become more moist, like once before is very oily. And then also the angle, you can see here the difference of lip angle. Now it's very downwards here, and now it's already lift up. And then here another example, I fix her fine lines, her deep lines, and also the wrinkles at the frontalis glabellar, also the wrinkles at the lateral part of her eyes. I always, in the older woman, in the aging case, I always put 2 unit for the labii depressor, yeah, and then the others is for superficially. So you can see the changings of color, the changing of the brightness, the changing of the textures, and also the eyebrow appearance. Just a little bit, but give her a very nice look, yeah. Compared to the previous one, is like a flat eyebrow. Now it's getting a little bit lift up at the tail. This is another case, same thing, yeah. I do at the frontal area, glabellar here. So it's like a V formation, 1 point, 2 unit here, 2 unit here, 2 unit here, and then spread all in the frontalis area except the lateral part, and then 1 unit at the eyebrow, yeah, and you can shoot it from here and from here to lift up to create the nice shape of the eyebrow. Look at this, from here to here, yeah. And then also the angle of her mouth still, and then the pore noise getting much better. And also in male patients, we need, sometimes I need to reduce the dose, like almost half of a female patients, because you know, in some male they're very conservative, and they're really scared with the bad Botox result. So just leave some wrinkles. You see, I don't remove all of those wrinkles. Some wrinkles I keep it there. Yeah, like also at the lateral part of her eye, some I leave it there. You know, it's create like some men, they love the wrinkles, but not too much, of course. Yeah. And then this is another example. You see, put attention on her eyebrow. Actually, her skin is quite okay, yeah, but see the difference before and after. Now it's getting more shiny. The texture is much better. And then, you know, some of my patients, they say, oh, I don't need to put makeup anymore. No more moisturizer because it's already moist, yeah. And then you see the changing of her eyebrow a little bit, but give her much better appearance. This is also another case. Yeah, another case. I fix the wrinkles of the frontalis, and then the skin textures. Yeah, the angle of her mouth. Yeah. And this is my last case for this morning. You see, when I take a horizontal line, you can see how her eyebrows positioning. The left side looks a bit lower than the right side, and the right side is lower than the left side in our point of view. Yeah. And then I fix this. So I just put the botulinum toxin at the center of glabellar, and then the procerus also. And then I put some dose at this or at the tail of her eyebrow, and then at the lateral part of her eyes, and then also the frontalis area, and all diluted botulinum toxin in all dermis to create a nice textures, and also to lift up the angle of her mouth. So I think that's what I can share for this time. Any question, please? Thank you.
Okay, Dr. Tompi, we give a big applause for Dr. Tompi. Thank you for your nice presentation, Doctor. Now we enter the question and answer session. I'm sorry, in the first time this morning, some audience cannot hear my sound. Hope this time you can hear my sound now. Okay. While we are waiting for the question to come in, let me ask you, Doctor, for the
Yes.
first question. As we know, the effect of Botox is a muscle relaxation. And in the case of enlargement of the masseter muscle, Botox can reduce the masseter muscle mass. How about if the Botox is injected continuously in the same muscle in the few times? Will this atrophy be permanent, or are there any serious consequences in the future if we injected continuously in the same muscle in a few times?
Yeah, thank you for the questions. So I've read some articles about this. If we perform a masseter injection using a botulinum toxin continuously, regularly, every 6 months, if we perform it every 6 months, and then so it means that we keep the muscle mass reduced, right? So it's become atrophy temporary, right? Yeah. So what happened is after we inject like tens or 15 times in intervally, some article reports that the size of that muscle is become smaller.
Yes.
So even though we not after, let's say, after 15 times of muscle injection, masseter muscle injection, and then after 15 times the patient bankrupt, no more money, so he can come to you for other injection. So the muscle is smaller than before, but it's not full atrophy, because our Botox dose, our botulinum toxin dose is not put the muscle at the zero tonus at all. So we reduce the but not like this is different with the patient, like in some patient, if we compare to some patient who has a disability to move, like they lay down, like let's say for 1 year, tetraplegia, they can't move at all, and then all of this muscle is become smaller, right? Very small.
Very small.
It's different with the Botox, with how Botox works. That's why we have to put in mind that we need to keep the maximum dose of Botox, of botulinum toxin for masseter. which is I perform like 25 international unit, or sometimes in a very big case we can go for 50 each side.
Okay. The maximum dose is 25 units for each side, or
It's a normal dose. It's my normal dose. Yeah.
better we reduce the dose in the next time and
No, cannot.
in
So keep the 20 25. Keep the 25.
next inject. Oh, we keep the dose in 25.
Yes. Because if you do
Okay,
if you do lower dose, the effect is not noticeable.
Dr. Tompi, in your practice, do you even using the toxin to reducing the nasal flare? Because in my practice, it's not quite
I don't believe.
a better result.
Yeah, I don't believe it. I don't believe
You
that.
don't know.
Yeah, I don't. I read some books that mention the alar white, the white alar can be reduced by injecting
Toxin.
some botulinum toxin at some point, right? But I don't think it works.
Okay, doctor. There is some question from audience. So let me read this question from Dr. Bea. Dr. Bea. Hi, doc. What's what is the important things to concern about when we do the cocktail? I think she has interesting about your cocktail, doctor.
Sorry, can you repeat the question, please?
Okay. What is the important things to when we do the cocktail? When you do the cocktail, what is concern?
Basically, if this cocktail is very personalized, so I believe some doctors, some foreign doctors, they have their own cocktails. So the dilution must be different. Yeah, but actually, if you have a strong concept how the botulinum toxin works, and then how many dose that you need for each area, then you can create your own cocktail. So it took like almost a year for me, to do some experiment to achieve a best result of botulinum toxin in every area. So I always write down the dose I use, and then do the evaluation 2 weeks, 1 month, 3 months, and 6 months, and then after that I readjust the dose until I already have my own dose in every layers is different for the frontal, for the upper part, middle part, lower part, for the even for micro botox in every area is different. So I do a lot of mixture preparation before doing the injection.
Okay, you adjust about the dose only, or you can adjust the mixture of the cocktail, because in our mind the cocktail is the mix about a few solution besides Botox.
Yeah,
Only reduce. Yeah.
you can put something else,
Oh.
as long as they have no drugs interaction with the botulinum toxin, and also have no side effect, of course. So I've read that some doctors, they put, even they sometimes they put also hyaluronic acid together with the botulinum toxin, and sometimes with the vitamin C, with the vitamin E, whatever it is. Yeah, you can have your own creations, as long as you have the basic knowledge why you do it. and be careful with the side effect.
Okay, thank you, doctor, for the answer. The next question is from Dr. Maria Angelina. PE oris muscle should be a bit weakened on some cases. Any examples?
Sorry, sorry, I can hear your voice once
Uh,
again.
you okay? Sorry. You say the depressor labii oris muscle should be a bit weakened on some cases. You hear my sound, doctor?
Yeah.
Oh, sorry. Okay.
Okay, I'll show you some case.
Okay. I, s- I repeat the question. Dr. Tompi, you say the pressure labii oris muscle should be a bit weakened on some cases. Any example, doc?
Yes, this is the example. You see, take a look at her mouth. Yeah, the lateral part of her lips is going down, right? Can you see this angle? And then this is the
Yes.
labii depressor, and then we should inject like a 2 units at this muscle, and then look at the result 2 weeks after. Now it's getting, without smiling, the angle now is getting lift up. Yeah. Also, wait. Yeah, I think this is a good example. Yeah. All right.
All right. Thank you, doctor, for the answer. We continue the question about the muscle from Dr. Maria Angelina Maria Angelina again. How about gummy smile patient that's be aging?
Uh-huh. Yeah, for the gummy smile, I don't put here in my presentation because the case is quite it's not a common case, not like a daily every single day. Yeah. But I prefer not to inject botulinum toxin for the gummy smile cases. Yeah. Yes, it works. We bring down the lips, the upper lips, uh, downwards. But uh, all of those patients, they have weird feeling, because when they talk, when they eat, when they smile, laugh, all of those expression is changing.
Aging.
Yeah, so it's not really important to cover the gummy. Yeah, once you feel discomfort with others thing. Yeah, so for myself, I don't perform anymore any gummy smile shot. So I prefer to do surgery for the gummy smile.
Okay. The next question is from Dr. Ubeta. Uh, Still in the pressure labii muscle. The question is, if after injecting the depressor labii inferior muscle, that makes smile become asymmetry, what you should do,
Cannot. You
doctor?
just wait and pray. That's why it's really
Oh,
important to,
cannot.
yeah, cannot. Nothing we can do. This kind of Botox, botulinum toxin is very dangerous. So don't perform until you really sure that you can do it.
No the
Otherwise,
procedure.
yeah,
Yeah.
otherwise don't do it, because there is no antidote for Botox. Uh, Different with filler. If we shot filler and then you feel unhappy with the result, you have the anti-filler. You just put a hyaluronidase and then problem solved. But Botox cannot. One mistake will be our bad history for another 6 months.
Okay, thank you. The next question is from Dr. Anastasia Selfie. Dr. Anastasia asks, "Hi doc, did you ever had a patient that already resistant with toxin? How we approach the treatment?"
Sorry, I can't hear your voice is
Okay, sorry. Did you ever had a patient that already resistant with toxin? How we approach the treatment?
Yeah, it's really important to know the patient history. Yeah, I think it's impossible to have a resistant patient if it is her first time for having Botox. But it can be happen. Actually, it's not a resistance. Yeah, I don't think resistance is the right word for this case. But in some patient who has already Botox for many years, yeah, sometimes the dose needed more, especially if the previous shot has been done in a quite big high dose. So it's always important that once you have a new patient, ask to them, do you have any Botox in the previous clinic or others clinic? And then if yes, can you remember which part and how many dose? So it's really important to tell our patients, I put 2 dose here, 1 dose here. So once the patient go to other doctors or abroad or any other clinics, it will help the new doctors to adjust their dose. Yeah, but if we cannot find out, yeah, I always mention to my patients, okay, I'll do the smallest dose that needed. After 2 weeks, we will reassess. If the effect is not working well, then means I need to put some more. So that kind of information is really important. Otherwise, the patient sometimes they can go mad, like I pay but the result is no good, blah blah blah. So it's really important to mention about it in the beginning.
Okay, doctor. The next question is from Dr. Nadia Carolina. She asks, how to prevent the medial brow ptosis in patient?
The medial brow ptosis. Okay. Let me show you this. Okay, medial brow ptosis, yeah, sometimes happen when you inject when the injections of botulinum toxins, yeah, goes to the orbicularis oculi at this area. Yeah, so it's be careful, don't inject this area. Yeah, otherwise it's going downwards. But I think for any patients, any doctors who has a workshop of Botox before, I think, yeah, we never shot at this area, right? So don't, unless what happens with the migration. Be careful for the older patients. In older and skinnier patients, yeah, the soft tissue is very weak. Yeah, the soft tissue is very weak. So sometimes we inject here, but the dilution, but the toxin goes surround to the surrounding area. It's I have some cases like that. Some days after, like 2 weeks after injections, 2 weeks after injection, I find out the improper reactions, yeah, like a droopy at some part. But yeah, it's weird, like it's only like a 3-5 days after that is going back normal. So that's what can be happen if the migration is happen.
Or can we use the some medication? No.
Sorry.
Or we can use the hot or cold compress to this area to fix the problem.
Yeah, but like I mentioned before, I don't think it's really work that way. Yeah, I don't think it's really yeah, it's really it has a direct effect because of the ice or warm compress. Yeah,
Okay.
just maybe we just need to mastering how to inject Botox properly, and then uh, uh, keep in our mind the muscle, the anatomy of face, uh, by by understand the muscle, then all of those wrong reaction can be reduced.
Dr. Tias asks us, do you mean we should avoid inject the wrinkle vertically from lateral canthal? Lateral canthus, I
Yes,
think.
yes.
Why?
It's it. Okay, I'll show you. Wait. I'll show you. So do not put any botulinum toxin at this area. This is the eyebrow, 1/3. Okay, let me show you here. Take a line here. Take a vertical line, 1/3 of the lateral eyebrow. From this line to the laterally, do not put any injection. It's very dangerous because the you our toxin will create the weakness of the muscle at this area, and it will give you ptosis of eyebrow.
Okay, doctor, for the last question from me, I'm interested about your statement about men need lower dose of Botox than women. But in my mind, man has a big mass of muscle. Is that a need to reduce the dose for the men instead to reach the same condition, the same result uh, with women?
What I mean is it's not to reduce the dose. Yeah, it's not the dose, but the point, the injection point.
Oh, the point.
So
Injection
if my patient
point.
is a
Okay, okay.
woman, I try to remove all of these wrinkles. But for men, yeah, I will keep some lines. I'll keep some wrinkles. Leave it there, like this. You see,
Yeah. Just a
a bit.
little wrinkle in the forehead.
Yeah, yeah, yeah. That's for example. Otherwise,
Okay.
they will feel weird. Some men has a different point of view about aesthetic with a woman.
Okay, Dr. Tompi, I think the time is up.
All right.
In the conclusion, the first topic of this morning in 7th session is Bonta or botulinum toxin can be used in macrodose and microdose. Men need a little bit or men will be reduce the site of Botox uh, depend on the woman, uh, and Botox can be used another part of body for another problems. Okay. Once again, we would like to express our gratitude and highest appreciation to Dr. Teguh Adi Fitrian for your valuable time with us today. Thank you, Doctor. Good morning and see you in the next time.
All right.
Bye-bye. All the colleagues from all around the world in the Iswam International Seminar and Workshop in Aesthetic Medicine Virtual Meeting 2021, the best scientific event presented by Pedaweri, Pedesti, and Indonesian Doctor Association today. Allow me to guide this presentation from Dr. Ineke until 12 noon. The second topic today is facial and body contouring with toxin, expanding the need from wrinkle to contouring, presenting by Dr. Ineke Jain Hidayat, dermatovenerologist specialist from Indonesia. Good morning and welcome, Dr. Ineke. How are you today?
Good morning, Dr. Henry.
Hello,
how are you
Dr.
today?
Ineke.
Hi, can you hear me? Hello?
Yes, I hear
Okay.
you.
Hello, doctor.
Yeah.
I'm very, very good. Good morning, good afternoon, good evening to every one of you, wherever you are. I hope that you are all doing fine.
Okay. Before her presentation, let me read her profile. For education, Dr. Ineke Jain Hidayat, graduate from the medical doctor from the Faculty of Medicine at Atmajaya Catholic University in Jakarta, and then graduate from dermatovenerologist from the Faculty of Medicine, University of Pajajaran, Bandung. She get a Master of Science from Faculty of Medicine, University of Pajajaran, Bandung also. And then he has a dermatologic surgery clinical fellowship training in Siraj Hospital, Mahidol University in Thailand. From some award, he has he grabbed the Indonesian Rising Star Dermatologist 2019, released by Cosmo Beauty Jakarta. And then now she work as faculty staff, Department of Dermatology of Indonesia, Jakarta. Okay, doctor, for the audience, you will follow the presentation. If you have the question, don't be hesitate to write the question in the Q&A box, and I will read your question immediately after session finish and answer by Dr. Ineke directly. Dr. Ineke, for the next 30 minutes, the time is yours.
Okay, thank you, Dr. Henry. Hello, everyone. I am very happy today that I am able to join the International SWAM 2021 with all of you. I know that every one of us is very, very eager to meet each other, not virtually anymore, but in person. But however, because of the pandemic, we have to be satisfied only by virtual meetings. And however, I will still give the best what I can do in this presentation to share my experiences and new trends in aesthetic medicine. And thank you for the International Swim Committee for inviting me to participate in this meeting. And for today, this is the outline of my presentation. And so botulinum toxin, I always present this before I start with the topic, with the main topic of my presentation, because I think it is very wise to know something, the history of something, to get familiar with it, to get us more interested with the main topic itself. Actually, botulinum toxin was found in 1820. It was named toxin because actually it was first initially discovered when there is a sausage poisoning in 1820 in somewhere in Europe, which caused botulism, which caused the patients to have like muscle paralysis. And however, the history expanded from bacteria, from botulism, to the usage or utilization of toxin to beautification, such as for wrinkles, especially for dynamic wrinkles. And now the use of botulinum toxin in aesthetic medicine has expanded more in facial contouring and also body contouring. And also other than that, it is also widely used for hyperhidrosis. So the mechanism of action, as Dr. Tom B. or Dr. Taufik has explained before, it consists of multi-step processes. However, the end result is the inhibition of acetylcholine release to the muscle. Hence, it will cause the muscle to relax. So these are the mechanism of action of toxins as a neuromodulator in aesthetic medicine. So it can reduce dynamic lines such as wrinkles, which is already widely used. And for your information, according to the global survey and also the United States survey, botulinum toxin injection placed the first position in the non-invasive aesthetic medicine usage. Other than that, the mechanism of action is to reduce muscle hypertrophy, which we are going to discuss about it, especially for contouring, and also autonomic function, which leads to the use of toxins in hyperhidrosis and also for oil reduction, and fibroblast contraction, which which leads to the use of toxin in facial contouring as well. So what is contouring? This is more popular in a makeup artist world. So as you can see, contouring is a technique or practice in such a way to accentuate or enhance the shape or structure of something that has existed before, such as the face or the body. So contouring is to accentuate to diminish some parts of our face or our body to accentuate other parts that we want to show to other people. So before we get into the techniques, we have to understand what makes successful injections. First of course, we have to know the anatomy, the target that we are going to inject, the muscles or the fibroblast, and what muscles we have to inject if we want to have certain results. Second, the patient selections and expectations. So we have to really have a good consultation to know what does the patient expect, and can we meet the expectations by the injections that we are going to give to the patients. So other than that, we have to tell the patients if they have contraindications to the treatment, such as history of hypersensitivity to toxins before, and also if there is any active infections on the sites that we are going to inject. And these are the relative contraindications, but you have to really communicate this to the patients, especially those with having unrealistic reasons or goals from injections, and patients who have neuromuscular disorder or history of for example, Guillain-Barré syndrome, anything that is related to neuromuscular disorders, and also patients who are pregnant and lactating, even though there has not been any evidence. However, you have to be very careful if the patients are pregnant or lactating. So the first thing that is, I think this is the most popular for facial contouring and using toxins, which is Masseter Reduction. And I know that this has become the trend since everyone wants a V shape on their face. So as you can see here, for Masetto Reduction, so what I'm going to show you first is this. So as you can see that in this patient, and for a confidential reason, please do not record or do not take pictures, because these are the patients from our clinic. So for Masseter Reduction, the target is for muscle hypertrophy. So we are going to reduce the muscle hypertrophy in these patients. So what you have to understand is that when you are going to have a Masseter Reduction, first we have to be very sure that the chubby face is actually caused because of the big size or big volume of the masseter. If the patients actually have a squared face because of the structure of the bones, whatever you are doing whatever dosage or whatever technique that you're going to give to the patient, you will fail to reduce the square face because it is the bone structure instead of the muscle. So what you have to understand, or what we have to really take notes when we are going to give injection for the Masseter Reduction, first we have to find the safety zone, because we do not want to create any problems for patients coming to our clinic with no problem at all before. So where is the safety zone for Masseter Reduction? So as we can see here on the right side of the slide, so we have to recognize where is the masseter muscle. So what you have to do is ask the patient to clench, to bite tightly, and then palpate the anterior border and make line between the anterior border, between the lateral side of the oral commissure, and then make a line to the earlobe, lower part of the earlobe, and that is your safety zone. Previously, it was known that the safety zone is between the tragus to the lateral corner of the mouth. But now, especially in Asian patients, the safety zone is recommended to make the line between the lower border of the earlobe to the lateral corner of the mouth. And what you can give to the patients is around, for female patients, you can start with 15 to 20 units, depending on the masseter muscle volume itself. And then, so here we can see why is masseter injection is popular, because other than a chubby face, squared face is also related to the aging process of the lower face, and a V shape makes the patient looks youthful. So we can see here that the safe zone is between the lateral corner of the mouth and posterior of the earlobe. And then where is the anterior safety zone? You have to palpate and recognize where is the masseter muscle, the anterior border, and then try to move to the posterior 1 centimeter away from the anterior border. And then you can inject 3 points or 4 points depending on the masseter muscle itself. So why we have to inject a little bit downwards than the previous recommendation? Because it is known that this is the risorius muscle. So if we inject too high, so this is the most common pattern in Asian patients, where the risorius muscle is located a little bit higher. So we are trying to inject lower because there are some patients with a lower risorius muscle. So we are trying to avoid injecting to the risorius muscle, because we do not want, after we inject the masseter muscle, the patient then cannot smile. So this is the reason why we move 1 centimeter away from the anterior border, and then we make the line from the lateral corner of the mouth to the posterior lobe of the earlobe. And then the pitfall in masseter reduction is that bulging of the masseter. Why does it happen? So I will show you the picture of our muscle, masseter muscle. So this is what happened if we inject incorrectly. While the patient is chewing or clenching, there will be a bulging on the masseter muscle. So what happened? As we know that there are 3 layers in masseter muscle: superficial, middle, and posterior layer. The most common mistake is we inject very deep, hence we did not it does not take effect on the superficial layer. That's why the muscle will compensate, and when the patients bite, the superficial layer will still contract, and it can be seen clearly when the patient's biting. And the second is asymmetrical smile. What happened? This happened when we hit the risorius muscle, so the patient cannot smile evenly. Another pitfall is sunken lateral cheek and skin sagging. So this is what we have to tell the patients. First, if the patient face is a little bit, so for example, if the patient face is like my face, which is, it has a very, very small volume of fats, and then a small, not so chubby, and then the age of the patients is around 40, you have to be very, very careful. Why? Because aging process consists of atrophy in every layer of our face, except the volume of our skin surface. So what happened if you are trying to reduce the masseter muscle volume, meanwhile all the fats, all the bones being resorbed, the skin surface is still the same. So what happened is, when there is no structure beneath the skin will go downwards and it will look saggy. So for especially for the patients who are 40 above, which has already skin laxity and sagging due to aging process, we have to be very, very careful, because sometimes, or most of the times after they are being injected to reduce the masseter, they will come back and complain, hey, I look older after I have my masseter muscle reduction. Actually, it was because the sagging of the skin due to reduction of the volume beneath the skin. Of course, if you have nothing to hold the skin underneath, the skin will fall down accordingly to the gravity. So this, I want to show you a facial contouring with mesotoxins, or with the hyperdiluted toxins, which is now known as mesobotox. This is a comparison between botulinum toxin A and saline. So we can see here on the upper picture, the patient has a more contoured jawline. Meanwhile, the patient, the left part of the face, which is injected with saline, there was no improvement at all. So we can actually make a more contoured jawline with botulinum toxins. And how to get there? So what we can do is we can inject hyperdiluted botulinum toxins on the lateral side of the face. So as you can see here, we can achieve upper face lifting and also mid face lifting. So when you're going to do upper face lifting, the target is the beneath the hairline. And then for the mid face lifting, the target is the lateral part of orbicularis oculi and the platysma muscles. And other than that, it is known that botulinum toxin A has effect to the fibroblasts. It can cause contraction. So what we want to achieve with contouring is the fibroblast contraction, which cause the lifting effects, because we know that if let's say if the skin contract, what happened? Imagine you have a sponge. You have a sponge, and if the sponge contracts, it will be tightened. And that is what happened to the face if we are doing micro Botox or hyperdiluted Botox on the lateral side of the face. So this is the target. As you can see here, this is a target where we want to hit when we are injecting the mesobotox. And what is the dilution? The dilution of botulinum toxin type A, it is ranging from 1 to 5 cc dilution, or 1 to 7 cc saline dilution of 1 vial, 100 units of botulinum toxin type A. So as we can see here, that the toxin, that the fibroblast will contract 12 hours after injection, or 12 hours after it is being treated with botulinum toxin. And we can see that this is the picture of the patient. The skin of the patient looked tighter 3 days after injection. And we can see here immediate result after mesobotox injection. The face become more tighter, and we can see a more contoured jawline, especially in male patients. They will love it, a more contoured jawline, because for male, it represents masculinity. And what we can do with the neck. For neck contouring, we can inject the platysma muscle superficially to make this line disappear and to make a more smooth contour of the neck muscle. And this is becoming one of the regimen of neck rejuvenation. So what you have to do is asking the patients to do contraction, to pull downward the mouth angle and see which parts of the platysma muscle is accentuated when the patient is doing such movement, and inject very superficial in this part with 1 to 2 centimeter away from each points. And each injection, you can give like up to 2 units. And what you have to understand if you want to give this kind of injection, first, try not to hit too deep, and then try not to exceed 50 units, especially in female patients. And you can see there are swallowing muscles beneath these muscle. So you have to be very careful not to exceed those dose and not to go too deep to prevent the patient from not being able to swallow. Other than that, we can see that facial contouring to the eye, which can widen the eye. What you can give to the patient is you inject the lower part of the face of the eyelid, each 2 units, but do not exceed the mid-pupillary line to prevent the medial part of the lower eyelid to become everted. And Gummy Smile, I heard that there is a question about Gummy Smile. And yes, Dr. Tompi was right that if we give injection to the Gummy Smile, the patient can feel a weird sensation. However, if they have experienced the injection and they would love to have another injection, what you can give to the patient is inject two units on the levator labii superioris alanasi. Here, just lateral of the alanasi, you can give 2 units. And because the function of it is for lifting the lips, that's why the patients may feel weird after we are giving injection to the Gummy Smile. But some patients, they are willing to do this injection, so you can just give them injection of the LLSAN for the Gummy Smile. And for body contouring, so I always say that beauty is in the eyes of the beholder. Some patients nowadays, they love being muscular, and some patients, they want to have a very slender shoulder. So what we can offer is the patients for the body contouring of the trapezius muscle is the patients who want to have a slender shoulder. And this also can give a longer neckline appearance. And this looks very girly. And for your information, this is myself. I love being muscular. So I do not want to have my trapezius muscle injected. However, for the patients who want to look less muscular, what you can do is injecting the trapezius muscle. How much is the dose that you can give to the patients? So you can give around 50 units per side. And the sites of injection is make a straight line from the lateral side of the neck. And then this is the lateral of the acromion, and make a sign 2 centimeter away from the acromion, lateral acromion, and then make points 1 to 2 centimeter apart. And you can inject here, each injection you can give like 4 to 5 units. So it is easier to inject from behind of the patients. Try to pinch the trapezius muscle to really recognize it as the trapezius muscles. And because it is for lifting, so sometimes if you want to do trapezius muscle, never inject the triceps or deltoid muscle, because it will make the patient feel they cannot lift things. They cannot lift their hands. They cannot lift objects upwards, because when we are doing trapezius muscle injection, the deltoid muscle and triceps will do the compensation for the trapezius muscle function. And other than that, injecting this part can give a relief effect for the patients who are experiencing shoulder tense, or patients who always work on the desk or office, typing and other office work. So other than that, the body contouring that is also popular is the calf contouring. First, we have to recognize which calf the patient needs to contour. Of course, the patients who have big muscles of gastrocnemius, not the fats, because if not if it is if the calf is big because of the fats, what you have to do is not toxins. What you have to do is refer to other doctors or who can do liposuction for the calf, or do the liposuction of the calf. So we can see here on the patients with a mild hypertrophy, we can use 100 units per side maximum. I usually use only 60 units per side. And then for moderate hypertrophy, you can give up to 150. For severe hypertrophy, you can use around up to 200 units of botulinum toxin A. And how to assess the patients is ask them to do this position to contract the gastrocnemius muscle and then try to palpate it. Try to see and palpate it. And as we know that the gastrocnemius has two heads, the lateral side and the medial head, the medial side. So we have to inject both sides. We have to inject both sides. But what I will suggest you is to see which side is more prominent. I think there's no fixed formula for how many dots, how many points that you have to inject, but you have to assess the patients. So what you can give is 5 units per injection with 1 to 2 centimeter away from each dots, from each points. And one side, I usually give up to 60 units maximum. And what you have to keep in mind is the patient who have the O-shaped legs. So some patients, they have this O-shaped legs. So you have to be very careful not to inject too much of the medial parts because it will accentuate their O-shaped legs. Okay, so the adverse effect is muscle weakness, especially if we give the patient more than 100 units. And other than that, what I want to show you is this, the soleus muscle. The soleus function for a flexor of our feet ankle. So if we inject too deep, then the patient might have a drop foot. Okay, so for the adverse effect and contraindication I have mentioned earlier, and for the adverse effect, it may be the side and needle related, such as pain, bruising, and some studies has proven osteoporosis in rats injected with botulinum toxin. And also immunoresistancy. But for osteoporosis in human, there has not been any studies established. However, we have to be very careful with the bias because most female patients actually has a decreased level of vitamin D, especially those living in Southeast Asia, such as Indonesia. And however, it is wise to keep this in mind. And immunoresistancy, especially those who has been treated with high dose and frequent injection of botulinum toxin. And common error for botulinum toxin injection in facial and body contouring is failure in injecting the lower third of the face because of the anatomy of the masseter muscle. We sometimes we inject only deep part of the muscle, and then compensated contraction of the contralateral muscle, failure to recognize the muscle related that we are injecting, and the muscle around the primary muscle that we're injecting, such as risorius muscle on the masseter, and trying to inject the same dosage in every patient. And other than that, the failure to combine toxins with other modality, especially more aged patients, especially when we are treating them with masseter muscle reduction. We have to also treat the skin sagginess, the laxity, and also the volume loss of the fat compartments of the face with either HA fillers or collagen stimulators or other modalities such as radiofrequency and so on and so on. As a summary, the use of botulinum toxin for aesthetic purposes has expanded more beyond traditional wrinkle. And it is one of the most seek non-surgical cosmetic treatments for facial and body contouring based on the principle muscle atrophy. And we have to recognize, to understand the anatomy if you want to get successful injection. And once again, beauty is in the eyes of the beholder, and whatever tools that we have in hands depends on the knowledge of us about the tools that we are holding. And thank you very much for your kindest attention. And you can reach me through these emails or social media. Thank you very much, and I will give back the time to the moderator, Dr. Henry.
Okay, thank you. Thanks again for Dr. Ineke for her excellent presentation. We give a wonderful applause, everyone, to Dr. Ineke.
Thank you.
For all you guys, the audience, you can send the question to the Q&A box, and then I help you to read the question to the Dr. Ineke while we waiting for the question from audience, Dr. Ineke. I have my own question about the development of botulinum toxin. I think the development of botulinum toxin doesn't seem to have made any significant progress in recent years. It's true, Doc. Because is there is there any new type of toxin being developed besides botulinum toxin? Any type of toxin besides botulinum, or botulinum toxin with strength, with a new composition to make it stronger or longer lasting or something? Because I know the brand is there. The botulinum toxin is botulinum toxin type A. What is your opinion, Doctor?
Okay, thank you very much, Dr. Henry, for a very wonderful question. So I agree with you that it seems that the development of botulinum toxin seems like not so much developing and not so significant, but actually the study about botulinum toxin these days, I think the most being studied about botulinum toxin is one of them is the immunoresistancy. Other than the indications, so immunoresistancy because of the resistance development in some patients in the recent years. And I think the development of, because of the immunoresistancy found in these recent years, what is the other development of botulinum toxin is producing some botulinum toxin with probably with the accessory proteins that is not known to stimulate the antibody. The first thing is that like the development in botulinum toxin studies is about the immunoresistancy, and there is still a lot of like controversies actually about the immunoresistancy. And other than that is the type of the botulinum toxin, type A, B, C, D, and up to G actually. But why is it only the A that is being developed? Because I think the receptors that we want to target mostly is the ones that is affected by the botulinum toxin A, and also some of them is B, but mostly is the A, the muscles, the autonomic functions such as sebaceous glands, eccrine glands. I think that is what I know. And other than that, what I see is being studied recently is about the side effects of a long-term botulinum toxins, which is lately it has been reported about osteoporosis, and then the reduction in bone density in patients, especially treated with not patients. Actually, it is only studied in rats. Gastrocnemius injection in the rats, it was found that they have osteoporosis. And there is another study which I read, patients who have bruxism, who has pain in the mandibular joints, but it is actually a case report. It was mentioned that the patient having a smaller bone volume compared to those who did not have botulinum toxin injections. It was said that probably because we know that muscle contraction actually increase bone density. That's why in like some workouts they encourage the people to do muscle strengthening to increase the bone density. And I think they try to correlate this reduce of bone density in the mandibular to the less contraction of the muscle of the masseter muscle, but it is still being studied. Oh, and the second question,
Okay.
the
Thank
formula
you.
of the
Huh?
yeah.
Hmm?
The second question, the formula
Formula.
of the botulinum toxin. Yeah,
Yeah.
there are some preparation which mix the botulinum toxins with hyaluronic acid. I think it will. I think, in my personal opinion, it will not make the effect of the toxin to get longer, because we know that it comprises the acetylcholine receptors on the muscle, but it synergizes the effect of the botulinum toxin, especially for fibroblast contraction and also for the pore reduction, because by collagen stimulation with HA or other formula, we know that the fibroblast or collagen remodeling will be more improved other only with toxin alone.
Okay, thank you, doctor. And I'm interested about the combination about botulinum toxin and hyaluronic acid.
Yeah.
How you mix the solution, Botox and hyaluronic acid in your practice? How
Okay.
much and how about percent of the solution?
Okay, so Dr. Henry and all the participants here, I don't usually mix my toxins with HA, but I'm saying that outside there is already a brand that has a mixture of HA and also toxins. But I myself, I do not usually mix HA preparation with toxins. Because I think I think I don't want to comprise the effectivity of each components I am injecting. What I'm doing is, if I do meso Botox on the face of the patients, I will dilute it with saline. And if I want to use HA to improve collagen remodeling, I will do what we call skin booster with HA. Yeah.
If you mix in the same area, you do the Botox first or the hyaluronic acid injection first before Botox.
Okay, I will do the HA injection prior or before the toxin injection.
Yeah.
Because yeah, before toxin, because I don't want to I don't want the toxin to spread to other parts when I am injecting HA.
Okay, doctor. Okay, for the audience, I still
Thank
waiting
you.
for your question. Is no, I don't find any question in my Q&A box from audience.
Okay.
I have
Oh, are they
a
asleep
another question
already?
for you, Doctor Ineke. Okay, I have the next question for you, Dr. Ineke. I'm interested about the Botox injection for the shoulder slender. Which size of the needle we should use, and how deep for the
Okay.
injection to the muscle?
So what I am using is the 31 gauge or 30, and the length is important, is 13 millimeter. So because you want to
And
target the muscle, we have to go deep.
we push the needle deeply or fully to the
Deeply.
skin.
Yes. Yeah. We target the
Okay.
muscle.
And how long we can find and how long we can find the result? We can see the result.
Uh, 5 days to 7 days, the patient will find the result quite improved. Usually for wrinkles, it takes 3 days just to have it start to take effect. But for muscles, bigger muscles, I think it takes like more than 3 days, 5 days to 7 days.
Okay, doctor. Because I don't find any question in the Q&A box.
Oh, there is a note
Uh,
saying here
if any
to
weakness of the leg,
okay, to refresh your application because there are some
refresh
questions actually
application.
coming in. Yeah,
Oh, okay. Sorry.
it's okay.
Uh, is there? Okay, I find a question from Dr. Meta. Dr. Meta, as you. Okay, wait.
It's okay. Oh, I miss the vibes from seeing people in person rather than talking to the laptop like
Yeah.
this.
Okay. Hello, doc. You say from Dr. Meta, hello, doc. You say that
Mm-hmm.
if we inject the masseter wrongly,
Mm-hmm.
that would give us a bulging appearance.
Yeah.
And how can we treat that condition?
Okay. So for the bulging after Masseter injection, what you have to do is inject the bulging part. So actually, I would not say that it is a wrong. It was not a wrong injection, but it was you did not inject the whole muscle. I will show you that masseter muscle as covered in this slide, that it has three components: the deep part, medial part, and the superficial part. So sometimes we inject only the deepest part of the of the masseter muscle, and if the masseter muscle is very thick, sometimes the superior or the most anterior part, we missed this part. It is very common. So what you have to what to do is inject this part again. You can start with 5 units, this part. So it's no problem at all. So just ask the patients to come and let's do injection again.
Okay, thank you.
Thank
For
you.
Dr. Maria Angelina, I'm sorry. I'm sorry. Uh, now I will read your question. There is two questions from Dr. Maria Angelina, Dr. Ineke, about masseter injection. Can it be done to TMG disorder patient?
Yes.
This is
Yes.
the
Yeah.
question number
Hi,
one.
Dr. Maria Angelina. Yes, it can be done for TMG patients.
And the question, the next question, still from Dr. Maria Angelina. May the HIV patient have a botulinum toxin injection? Is there any contraindication for that?
Up to now, I don't see any contraindication for HIV patients being injected with botulinum toxins. I hope that answer
thank you.
clearly, Dr. Maria.
Okay, this is the question from Dr. Irene. Is there any difference between male injection pattern versus female patient in forehead, doc? Thank you.
Okay. Hi, Dr. Irene. Or
Irene, yeah.
okay. Hi, Dr. Irene. Okay, so actually, I did not cover about the forehead injection. However, I will try to answer to that question. I think what what you are trying to ask is about the wrinkle on the forehead. So I'm so sorry that I do not prepare that on my presentation because we are talking about facial contouring. However, so let's see this pattern. Let's see this slide. So for me, what I will tell male patients is that male, their natural eyebrow is not as highly arched as female. So what we want to do is that we do not want to make the male patients to look like female. We do not want to feminize their face. So what we do is that, so for male patients, I will inject a more lateral part of the frontal area, because if we leave this part, what happen is that the eyebrow is going to be lifted. So for female patients, they sometimes love their lateral eyebrow to be lifted up because it makes them look more younger, look more fierce. But for male patients, they will look a little bit feminized. So I think for me, the different pattern is this, like for male patients, I will inject more lateral, but for female patients, I will always ask them, you want your eyebrow to be lifted up or you want it to be flat? Because some patients, they do not want to have a lifted eyebrow because they don't want to look fierce. I think, yeah, that is the common difference between male and female.
The next. Okay. The next question, and I want to greet our colleagues from Timor Leste, Dr. Gomez. Dr. Gomez from
Hi,
Timor
Dr.
Leste.
Gomez.
The question is it safe to inject Botox at calf? Any side effect, doc?
Okay. So, one thing I want to tell all the audience here is what I am sharing here is all of them are off-label. So what I mean by off-label, it is not approved by FDA. So we have to be very, very careful. And thank you for the question just now. It reminded me to remind all of us here that these are all off-label indications. So for toxins, the only approved by the FDA is the upper face. Even the lower face is off-label. So try not to make mistakes. And so for calf, it is safe as long as the patient does not have neuromuscular disorder. Second, you know the anatomy and the function of the muscle. So when we are trying to inject safely on the calf is, first, I try not to exceed 100 units on both sides, even though in this patient, they use 100 units in each side. So what I do is I only inject 60 units per side, because if if the patient is not satisfied with the result, we can do injection on the next session. What you have to do is to make a good consultation with your patients and tell them why you start with a lower dosage, because everyone has different reaction. And if the result is not sufficient for the patients, you can tell them to come again next session and have injection, more injection. And second thing is this: try to understand, try to avoid inject too low, because we know that there is a soleus muscle beneath the gastrocnemius muscle on the this part, on the lower part of the gastrocnemius muscle. So here you have to inject very, very careful. Try not to inject too deep. Use 13 millimeter needle length to inject this part, because you do not want to hit the soleus muscle. This is the muscle that you want to avoid, the soleus muscle here, which is covered by the lower part of the gastrocnemius.
Okay, thank you for the answer, Doctor. The next question is from Dr. Kisanti. Dr. Kisanti, as you, Doc, for mandibular contouring due to submandibular gland enlargement, sorry, wait for a minute. Okay, Dr. Kisanti, as you for mandibular contouring due to submandibular gland enlargement, that's the question. I don't know what is the question. Okay, can you explain something?
Okay, so for the submandibular gland here, we can do toxin injection here on the submandibular and also the parotid glands. Sometimes we have to see that the double chin might be caused by the submandibular gland. Yes, we can do toxin injection. You can start from 10 to 15 units each side of the submandibular gland. And other than that, you have to find, why did the patient have submandibular enlargement? First, it occurs mostly in patients who drink excessive alcohol. That's why it is found a lot in Korea, in Korean patients, because they consume alcohol quite a lot. Second, patients with bulimia. So we have to really dig the patient's history, because it helps. Other than toxins, we try to help with the cause of the enlargements.
Okay. The next question from Dr. Jane Natania.
Hi, Dr. Jane.
Or 6 months.
Sorry, I couldn't hear.
Will solder and calf injection. And calf injection lasting since the muscle are way bigger. Okay, that's a question. I think she want to know how long the effect of the calf injection will last, Doc.
Around 6 months.
6 months also. Okay.
Yeah.
Okay.
Actually, it also depends on the patient's activity.
Okay. Okay, from Dr. Tias, in what condition patient will feel heavy head effect when lifting the eyebrow up, doctor?
Okay, so the heavy effect when lifting the eyebrow. So this is about frontal, right? Okay. I also do not. I also am not covering about this, but I will try to answer. So if we see patients, especially the older ones, you can assess them. If they open their eyes and you see that they have to contract their frontalis muscle to open their eyes, like that, to open their eyes, they have to contract this muscle. Then if you inject the frontalis muscle on those kind of patients, they will experience that problem, heavy eyebrow.
Okay, I think this is the last question from Dr. Maya Safira, because the time is up. Uh,
Sorry, I couldn't hear you. I'm sorry.
okay, okay. I repeat the question. Now you can hear my
Yes.
sound, doctor.
Mhm.
Okay, from Dr. Maya Safira, when we do the shoulder slender treatment, is there any caution for the patient after treatment?
Okay, so Dr. Maya, for the shoulder slender treatment, if usually the ones who are asking this are female patients because they don't like a muscular part like this, like bulky part. That is the indication for patients for having that kind of injection. Uh, uh, Usually it is caused by overtraining of the trapezius muscle. So this is the indication. Some female, they do not like this muscle here. So yeah, and this is the indication to make it slender, to make the trapezius muscle atrophy. And what we have to be very careful after the injection is that first we see here what we are trying to inject is it only the trapezius muscle here. So what you have to do is you make a line here from the lateral side of the neck, like make a straight line perpendicular to this. So this is the part that where we are going to inject. And this is the anterior part that we're going to inject. What you have to be very careful is not to inject too medial here because we do not want to inject the neck part. So make a line here from the lateral neck here. And you can actually palpate and pinch the trapezius muscle. Try to make it 2 centimeters away from the neck, the first injection point, and 2 centimeters away from the lateral part of the acromion. That is the most lateral side of injection. At each point, you can inject 5 units, 4 to 5 units, 4 to make it easier to count, like 0.1 cc, and 2 centimeters apart, away from each other. I think for trapezius muscle, that's all that you have to be aware of. Try not to inject too medial, try not to inject too lateral, and so spare 2 centimeters from the lateral part and medial part, and then inject deeply to the muscle. And actually, this help.
Okay,
Yeah, this
thank
help
you.
with people who have tense shoulder. It relieves your headaches. It relieves their shoulder tension.
give a big applause for Dr. Ineke for this
Thank you very
for
much.
her excellent and very interesting presentation today and answering our question today. Thank you, Doctor.
Thank you. I miss you all. I miss to see you all in person. Thank you very much. Iswam.
In conclusion, in this presentation, we can use Ponta widely for many kind cases for body contouring. I remind you all the colleagues for the chapter B in this media in Iswam, a virtual meeting in 2 p.m. And I'm Dr. Henry Hartono, representing of the Iswam Management and Committee, express the gratitude for the presence and participation of fellow doctors throughout. Thank you.